started, what we'll do is hold off on the board reorganization until he arrives.
Sounds good. We did receive requests for public comment from Grace Tetrault and Kalina Michova, as well as I had just forwarded to the board's attention. We received written documents from the New England Convenience Store and Energy Marketing Association, as well as public relations and lobbying firm on behalf of Philip Morris. They had indicated that they might attend, but did not necessarily request to speak during the initial public comment period. So it was just, I think, the two folks that I mentioned.
Right. Well, let's allow them to speak.
Okay.
And Tim, just so you know, I was trying to get my laptop working and it wasn't working, but now it looks like it is. So I may be switching from one device to the other. So if you see me join again, that's why, and then I'll switch over.
Okay. Um, Grace and Kalina are being promoted to panelists if they would like to make a comment. And then
All
I
right.
do see one person, Steven's hand up, so I can,
Right.
if we have time after those two people that are registered in advance, we can.
Mm-hmm.
Oh, and another person. Hi, we'll start with Grace, just because alphabetically your name was listed before Kalina. So if you'd like to make a public comment, the board is here.
Good evening, and thank you for allowing me to speak. My name is Grace Tatro. I'm 16 years old, and I'm a junior at Needham High School. I live here in the town, and I'm speaking as a concerned student and a member of SALSA, which is the local club at the high school for students advocating for life without substance abuse. I'm an advisory board member on SALSA, and next year I will step onto the leadership team. I work with the 84, which is a statewide organization against nicotine use. And I go to the State House every year to advocate for policy banning the use of nicotine. I also play girls rugby at the high school, and I can see how addiction affects athletes and my coaches as a whole. I do have one or two teammates who do use nicotine, and I can see that this use definitely affects not only their performance on the field, but also outside of the field. I could see them on the field, for example, like they're winded, they really can't keep up. And it's mostly stemming from the use of nicotine pouches, as this is a very new thing and they become very addicted to this. And outside of school, it takes up a lot of their time, this addiction, as well as their money, and it stresses them out a lot along with school and sports. So today, and also, my coaches and many other teams at the high school have a no tolerance policy for nicotine use, which means that you are kicked off a team if you're caught using nicotine or drinking or vaping. So today I'm here to urge the board to support the banning of the sale of nicotine pouches in Needham. Another way I see that nicotine pouches affect my peers as a whole is at the high school. I see nicotine pouches littered all over the high school, in the parking lot, in front of school, on the fields. I can even see them stuck under desks like gum. And I think it's a much easier way for students to be able to use nicotine in school as opposed to smoking because that's very easy to detect. But nicotine pouches are very inconspicuous and can just be stuck in someone's mouth during class at all times and really not able to be detected. And according to the Truth Initiative, using nicotine pouches and other tobacco products concurrently increases the risk of nicotine addiction and dependence. It's not only used as a way to get rid of a nicotine addiction. So I really just urge the board to ban the sale of nicotine and protect the young people in our town. Thank you.
Hey, thank you.
Thank you.
Next we have Kalina.
Yep. Hello. Thank you for allowing me to speak here today. My name is Kalina Mihova, and I'm also a junior at Needham High School. And I'm also a leader of Salsa, which is, again, a student-run club that focuses on substance abuse prevention within the community. And I'm here today because of my concern regarding the use of nicotine pouches, especially because of brands such as Zyn, which are specifically targeting youth like me and my peers through their campaigning and marketing. And these companies are creating flavored products to draw in youth. and market these pouches as safer alternatives to smoking when in reality they're packed with high levels of nicotine and chemicals that have been linked to cancer and serious health risks. And in school, I've been also increasingly seeing students use ZYNs, and in bathrooms, for example, because of how much harder they are to detect than cigarettes. And most of the time, they aren't even used discreetly. Like I've also seen them in water fountains and in locker rooms or people in sports using them. And sadly, I've also seen these types of products get in the way of some close friendships. And Needham data from the 2023 Metro West Adolescent Health Survey shows that 3.3% of high schoolers here are already using nicotine pouches. And nationally, nearly millions of students have reported trying them. And what worries me the most is how these products are also being pushed on vulnerable groups and students of color. And we've seen this before with cigarettes when we were able to reduce smoking through policy and awareness. And we similarly have a chance to act now. And as a student living in this reality, I'm urging the board to recognize the threat and take action through new regulations, either limiting or prohibiting the sale of nicotine pouches. Thank you.
Okay, thank you.
Mr. Chair, the board's policy is to recognize first people who've registered in advance or made clear their in advance their intent to make a comment. There are 3 people who are attendees who have raised their hand that would also like to make a comment, but the board's policy is as long as time allows. So do you want me to promote those folks?
I would, yes, please.
Yes, sir. We'll vote Stephen Helfer first, then Isabel and Jonathan. Stephen?
Hello, my name is Stephen Helfer, and I'm representing Cambridge Citizens for Smokers' Rights. We accept no funding whatsoever from any source. And I know there is concern about young people and their use of tobacco or nicotine. But I think it's important to note that last year in September, the FDA announced that the teen smoking rate was the lowest it's been in 25 years. And the vaping rate had gone down and was the lowest it's been in 10 years. In January 16th, the FDA authorized, after, quote, rigorous scientific review, end of quote, 20 different types of nicotine pouches for adult use. And the agency also noted that even though many adults are using these products, teen use remains low. For years, the FDA has prescribed gum, nicotine lozenges, nicotine patches, and inhalants. These products, people do not get addicted to them, and they are not associated with cancer. I think that is a misconception that people have. As far as the danger of nicotine, just before this program, I did a search on Google for nicotine poisoning deaths and came to an NIH study that said between 2013 and 2017, although 10 million Americans were using electronic cigarettes, otherwise known as vaping, they did not come up with a single death associated with this. My point being, the dangers of nicotine, I think, are overstated. British psychiatrist Michael Russell, who was considered the father of tobacco harm reduction, in 1971 said, quote, "Unlike many other addictive drugs, nicotine does not impair judgment or behavior, and if anything, it enhances cognition, motor skills, and work performance. End of quote. To close, I would like to say that in Massachusetts, we allow adults 21 and over to use their judgment regarding products such as alcohol and marijuana, both of which impair judgment and impair driving skills. Nicotine does neither of those. I think we should allow adults to be free and convenient to buy nicotine products as long as the adults are 21 and over. Thank you very much.
And just to clarify, you were not a citizen of Needham, is that correct?
I am not a citizen of Needham. That is correct.
Okay, thank you.
That one for
Hi, my name is Isabel Tashi, and I'm a Needham resident. I go to Needham High School, and I live on 108 Newell Ave. Like Kalina and Grace, I'm a member of SALSA, the Substance Prevention Club at Needham High School. I also work with the 84 movement and with Needham's Public Health Department and span the Substance Prevention Alliance of Needham. I'd like to thank you for letting me speak today, especially when I was not initially on the agenda. Sellers of nicotine pouches like Zyn would like the public to believe that their products are safe alternatives and are meant to help adult users quit. However, Zyn is owned by Philip Morris. Philip Morris does not want people to quit. Historically, they've targeted young people, calling them terms like pre-smokers, because they want young people to replace current users who are eventually going to die. They need replacement smokers. The industry has also historically used practices like rewards programs and advertisements involving youth, and then is currently adapting the same policies using social media with people called Zinfluencers who are using their products specifically to be marketed towards young people, using reward programs that target young people, and also strategic marketing where their products appear as though they are icebreaker containers, mint, or even candy. On an 84 State House visit, I remember I was speaking with one of my representatives, and I showed them a Zyn package, and they mentioned that this looks like candy. And I asked them, do you know what this is? And they said, no, I would never think that that would be anything harmful, and I would never guess that that's a nicotine-containing product. However, Zyn pouches, like Kalina and Grace mentioned, are constantly littered throughout the school. There are plenty of youth using them, and still teachers are unaware. As Ed Rand, a tobacco control specialist, explained, when the industry says that they're trying to protect you and help phase out tobacco products, that's a lie. They're trying to make money. That's what they care about, money. Philip Morris does not care about helping people quit. They care about having people continue to use, making products with heavy amounts of nicotine in them. They want to keep people addicted, so they will keep buying their products, and they're using youth as their basis for purchasing these products. In 2023, there were over 200 million shipments of Zyn pouch products into the US. In comparison, between 2016 and 2018, there were around 40 million imports of e-cigarette products into the US. Zyn pouches are quickly taking over our American youth, especially within towns like Needham. I've seen plenty of youth using, and the industry has continued to reinvent itself, addicting new generations of users. I think, and I hope that you all will adopt the same viewpoint that in order to ultimately stop the tobacco industry, we need to phase out these products for good. I believe that it was a step in the right direction to implement nicotine-free generation and that policy within Needham, and I'm incredibly grateful for the board's decision to do that and protect our future generation of youth in Needham. And I think that in order to ensure that that policy is going to work, we need to have that revolve around all products. And just because the industry is marketing these products as a safe alternative, just like they did with Juul and e-cigarette products, we can't fall for that trap again. And we have to recognize that what this industry cares about is money. They do not care about the health of our youth, and they absolutely do not want people quitting. So these products are not intended for youth to quit. Thank you.
Okay, thank you. Okay, and finally, we have Jonathan.
Hey, hi, my name is Jonathan. I volunteer with Stephen at Cambridge Citizens for Smokers' Rights. I wanted to thank you for having open public commentary early in the meeting. That's very helpful to us. Um, I would greatly prefer that everybody is allowed to smoke and use nicotine products. I mean, had some mental health troubles when I was a teenager, and I quit smoking, and my anxiety got awful. So, the availability of tobacco and other nicotine products might be very helpful for students who can't pay attention or where Ritalin's not quite enough. And I think everybody should be allowed access to coffee and cigarettes to do homework, to have a smoke break to help them hold honest work. And I'm just not a big fan of non-smoking efforts. And I mean, we don't, smokers don't push anything on non-smokers, at least not really. And I, I just greatly prefer that people, aren't restricted from smoking or buying, nicotine products. And, somebody can join the Marines at 18 and buy a machine gun and drive a big truck and vote and raise a family and adopt children and so forth. I'd really rather they're allowed to purchase, a pack of cigarettes or at worst a nicotine product. But I mean, that's it. Nice.
Okay, thank you.
Nice.
Okay. Very well. I see we're all here now as well. So first thing we have on our agenda is board reorganization, which we delayed last time because not everybody could be here. So Tim has you as doing this, but it's pretty easy. I'm going to nominate Ed to be chair of the Board of Health. He's willing to accept that.
I guess I will.
And now we need a vice chair as well for the next year.
I nominate who's up for re-election next year? No, nobody.
It's
Rob, I
it's
guess?
you, and then it's going to be Artie and Rob.
Okay, I'll nominate Artie.
I accept the nomination. Thank you, Ed.
Okay.
And then
Anybody else interested? Self-nominations are welcome.
I second Ed on Ed and Artie.
we don't generally have a role for the clerk, although technically we name one.
We have not named one in the past.
In the past, yes. Town council does suggest we name one in case both the chair and the vice chair are not available, but it's not necessary if we don't want to.
Well, if that's the case, I guess we'll nominate Rob to be secretary and clerk.
And I accept the nomination.
Oh, there we go. All right. I think we're safe in closing the nominations. I'll make a motion to move the slate.
Okay, I'll second that.
Okay. All in favor?
Aye.
Aye. Aye. Yep.
You
Okay.
have to do roll call or not?
I think we just did by
Okay.
visual roll call. Congratulations, Mr. Chair.
Thank you.
The meeting is
I'm
now
going to ask you a
yours.
favor for tonight.
Mhm.
I'm having problem with my internet connection, and it's breaking up all the time. And so, could you continue for tonight? I know.
Sure.
Okay.
Unless the vice chair wants to do that.
I will run this one, and then for the next one, I will be the vice chair. How's that? If that's okay.
Okay.
Thank
Yeah.
you. I'll be a bit on a learning curve for today.
Okay.
Okay.
Thank you. Thank you, Steve. Thank you, Ed.
The next item is the approval of minutes from April 18th.
Move approval.
So
I
moved.
second.
Approval.
And I think I missed this one, so I'll probably abstain or whatever needs to happen for that.
And so, Artie, as the chair presiding, I think you just call for a vote now that there's been a motion and a second. and Tejal said she does want to abstain, but I think we've got at least 3 people who were here that could vote in favor of approving the minutes.
Yeah, I second it. Yes.
Okay, did you want to call the vote now that there's a motion a second, or you can technically see if there's any debate on the motion?
Is there any debate on the motion? I don't hear one, so we can pass it. So the minutes are passed.
Technically, we need to call a vote, so we could do a roll call, or we could do show of hands, or we could have whoever wants to speak in the affirmative. I don't think it'll be a close call, but technically we're supposed to have the board vote.
Okay. Can we all vote for the minutes to be passed by show of hands, please? Okay.
And Tejal, you're going to abstain, so that's 4 in favor and 1 abstention. Great. Okay. If you'll wait with me 1 second, Madam Chair, I'm going to pull up the monthly reports, and I'm going to start admitting staff to the meeting. Tara and Sai are our first ones up. And okay. Okay, Tara and Sai, you're up.
Okay, I'll give a quick start and Sai can follow up with the rest of the updates. But the update I was going to share was on the enforcement of the Zyn nicotine vape products, I should say. It's the vape products section of our highlights. Specifically, I did do some site visits with Alexandra, our intern, and she and I were able to buy some sample vape products that had a clear flavor to them, or it said clear on the box. And so, because we were told that by another regional tobacco compliance person that these may also have a characterizing type of flavor or odor. So we did find 3 of these products at 2 of our establishments in town, and we brought them back to the office and we tested them by basically opening up the packaging and smelling them, and we were able to smell a minty type odor. One of them we put in a Ziploc bag, let that sit for a few days, and did come back to that and smelled inside the Ziploc, and were able to pick up a mint type odor for these products. So what we're going to do is bring this, we've already sent letters out to our retailers regarding those products with Cheryl Sabar's approval. As far as she gave us the go ahead, we are able to enforce those since we did this internal testing, and we were able to indicate these as having a characterizing flavor. So we'll be following up at the June meeting with more information to share with you, the board members, as well as that process proceeds. So we'll keep you in the loop on that. Okay, Sai, you can go ahead and give the other.
Right. We also just sticking with the tobacco topic. We did tobacco compliance checks in the month of April, and all the stores passed. And I anticipate doing at least another compliance check this year, and testing for the nicotine-free generation part of it, like trying to find a student or find a person that is over the age of 21 that just turned 21 in 2025 is kind of difficult, but we'll try to find someone to perform that test later this year. We also completed a full self-assessment for all their voluntary national retail standards, FDA retail standards. And that full self-assessment is due every 5 years. So the next one will be due in 2023. So staff we'll be working on that probably in 2029, whenever that comes up 4 years from now, to do another full self-assessment to see where we are at with each of the standards and then fill in the gaps as we go along. The whole point of the standards is it's an iterative process where we're trying to figure out like what are the gaps with the standards and trying to meet them over a period of time. And we're making progress in that. Alexandra has been really great with helping out with different standards, including standard 9. So right now she's working in standard 9, looking at inspectional data from 2021 through 2024. And we want to do a risk factor analysis using that data, figuring out what are the most common risk factors that relate to foodborne illness outbreaks, and then trying to create intervention around that. So we're planning, so Alexandra is going to be working on that, and we're planning on having a summer intern that will be also working on the project. Also in early May, but also we worked on it in April, was that we hosted a food advisory board meeting as part of Standard 7. And we invited both the public and also folks from industry, which included food establishments, and we had 20 people show up. We discussed 2 different topics. One of them was the adoption or potential adoption of the 2022 FDA Food Code, and what were those changes and how they might impact the public and also retailers or food establishments. And we also discussed the topic of food waste and how the town could do more with that topic, maybe try to reduce it or divert food waste in town as needed. Also wanted to mention that I think Ed brought up St. Mary Street housing case that we're working on for the last couple of months. I did do a site visit in April and spoke with the occupants, and the conditions there have gotten to a point where I'm happy or I'm okay with dropping the case. Like the backyard's completely cleared out. There's some items in the side yards, but they've agreed to continue to clear that stuff out. And I believe that there shouldn't be these conditions shouldn't reoccur in the future. So I've sent out a letter to them stating that that the case is being dropped for now, and if we get future complaints, we'll reopen the case at that time. What else?
I know, Madam Chair, I see Dr. Epstein's hand up.
Yeah, I just wanted to ask Tara a little bit about the characterizing flavor stuff.
Sure.
Just since this is going to start getting tricky, is my guess. So I'm just wondering if we have a process, or if we should try to establish a process by which we do this. Because it sounds like, well, I smelled it and I smell something. Hey, do you smell something? And that is not going to be as good, I think, as, having 3 people like independently, do it without being in the same room or what have you, but there needs to be some sort of independence to, the observers who are actually doing that. I think that's just going to make it a little bit tighter when we get challenged on this. That's all.
Sure. Yep. I can tell you that the initial testing with Alexandra and I was out that day. That's why we had done this. And then he came back, I think, a week later and did the other tests and noticed the other tests. But I hear you. We have to have a written protocol maybe on how to do that.
Sure. Yeah. Yep.
Okay.
That was all.
Sure.
I just want to add to that, and we may discuss it later. The characterizing flavor issue, I think, is going to be really difficult because as soon as we say, okay, this one does have a characterizing flavor, you can't sell it, the next month the retailers will produce something else, or the producers will produce something else, and it'll be this constant whack-a-mole game. And, we'd have to decide, I think, whether we would want to continue to enforce this way. I mean, that's going to take quite a bit of effort to always trying to be eliminating these characterizing flavors. Well,
the other way that we might be able to do it, Rob, is require that the retailers actually submit it for testing before it goes on their shelves. And then, we can do it as time permits, but you can't put it on your shelf until it's been approved.
That's an interesting option. I hadn't thought of that.
Or could we require the packet has the term unflavored or something like that as a requirement? Or is that do they still try to get around that with things? I'm just wondering if we can restrict it in some other way.
Yeah, I know a lot of the products that are called clear now are these alternate products that do have that minty smell and odor, which we were given guidance on that. That's why we kind of honed in on those types of products. So
But I'm just thinking, is there like, if say they have nothing, do they specifically say unflavored, or is that not necessarily the case?
not on these products. They didn't say unflavored.
But if there was an unflavored one, because these failed, but if there was really one that would pass muster, I guess how are they labeling that one is what I want to know.
We'd have to look into that.
Yeah, and I wonder if unflavored they're going to try to get away by adding a sweetener of some sort. So it doesn't have a flavor, but
Yeah,
it
are there any other boards that have some kind of protocol for this? Do we know?
So Cheryl Sabara had given us the guidance on how to test those products, and but I can reach back in touch with her if you'd like and get information.
Find out where it came from that she got it.
Sure. I can do that.
Yeah, so at the moment, the manufacturers, when a product is brought into Massachusetts and sold here, they sign a letter stating that the product is unflavored, and then that's the reason why it can be sold in stores in Massachusetts. But obviously, they're signing a letter, but these products are still flavored when they are put on the shelves. So the only way to actually know is to test the product at the local level.
So, but wait a minute, there's some written evidence that they're producing saying that this is unflavored.
Yes, so the stores are supposed to get those letters from the manufacturer, and once they get those letters, they can sell it at their stores. And we have the authority to ask for those letters, and I did receive the letters for these clear products, and they state that they're unflavored, but obviously after smelling them, they have a scent to them.
That gives we should share that with Cheryl, because that gives a legal basis actually for false advertising against the companies, because they are advertising this as unflavored or representing that they're unflavored when they're not. So that's another avenue to combat this, is to take legal action or to threaten it. But you're gonna need we need bigger guns than just, the town. And my guess is every other town that's doing this would probably join in.
Yeah, that's a good point.
Right. And around the discussion about like what other boards of health are doing, it sounds like each one is taking a different stance on this. It's like the protocols are a little bit different, how they're testing it, how they're enforcing it. So it's like it's being done differently in each town. So there isn't a set procedure set in place that everyone's using.
We have hope. There is a bill at the State House to make nicotine-free generation state law, and the Mass Medical Society just voted to support that as well last weekend. So hopefully that will get some standardization across the state.
So for the protocol, then is there no state level protocol as well? Is it all subjective so far for the flavored versus unflavored?
I believe MHOA has some guidance about how to perform the testing, and they recommend doing a small check first. But what we found talking to some of the other staff and other boards of health, it kind of varies. They try the small test, but sometimes, or they bring it to the board, and the board does a small check on the products, and the board makes a decision, or the agency themselves. It really depends on how each board of health is organized and where the authority lies.
In this instance, we did clarify with Cheryl that a designated agent of the Board of Health can make the determination. If the board chooses to want to essentially conduct the smell test themselves, we can certainly do it that way, though.
Mm-hmm.
We did, as Tara and Sai mentioned, consult with Cheryl from the Mass Association of Health Boards, as well as Mass Health Officers Association, which runs tobacco training on behalf of the Bureau of Substance Addiction Services Tobacco Control Program. Were there other environmental health updates that you wanted to cover, Tara or Sai?
I had one other thing. So there's a new restaurant opening up in town called Noodle Doodle right in front of Town Hall. It looks like they're close to opening. I did do a visit in late April. I met with the owner. It's still in the rough stages of being built out, but I did give some recommendations to them, and hopefully they're in a closer stage of opening in hopefully in June or maybe late May. I'll know more information later on.
Any other questions? We could go on to the next topic, Madam Chair, if you want.
Yeah, sure. Any other questions? None. I think we can proceed, Tim.
Great. Okay.
Next topic.
Then accreditation.
Hi, everyone. There's really only one thing that I want to highlight. In the monthly report here, I indicated that the Public Health Accreditation Board would reopen our files the week of May 19th, and they did so last night. So we have the initial we have the feedback from FAB about which documents we need to either submit alternate documents for, which requirements we need to submit alternate documents for, or which we may be able to adjust. There were 26 documents out of several hundred that were identified that need some work. We have 45 business days to do so, and our deadline is July 24th. I'm very confident that we will do that we'll make that deadline.
Excellent. Thank you.
And I think Lynn alluded to it briefly, but that's a pretty small number given the total volume of documents submitted. So I think it speaks to the work the board and the staff have done, but especially the work that Lynn and Allison have done getting our documentation ready.
Thanks, Lynn. Tim, do you want to move to the next topic?
Sure. So I believe Rebecca is also on for traveling meals.
Yep.
Rebecca.
Okay. The meals are still currently being delivered by our volunteers. We are switching over to the summer help on June 13th. So we did the hiring process in the month of April. We conducted our interviews. Offer letters were sent out in first week in May. But I'm jumping ahead. The numbers, funny enough, were the same as they were in March. I don't know how we managed to do that. So 856 and 856. The client numbers didn't change. We stayed at 48 clients. And I did include flyers for property tax assistance for owners of single family homes. Yeah, that's kind of a quiet month, except for the hiring. Any questions?
I feel like you should play the lottery. That seems like very unlikely there would be the exact same number of meals each month.
I know, it was weird. Same number of clients, same number of meals.
Lydia and Carol, I think you're up next. Lydia, I did want to draw the board's attention to page 28 in the packet, but Lydia forgot to update her credentials, but Lydia achieved her CPS, which is Certified Prevention Specialist. Was it technically in April or was it in early May, Lydia?
Thank you. It must have been early May. It was May. I'm looking at my calendar.
Okay, so technically I didn't have to add the plus CPS, but
Thank you for doing that. May 9th, I took the exam.
Congratulations.
Thank you.
I'm proud of Lydia. And do you want me to just do my brief, my personal? Hi, Lydia has done so much, and I'm really proud of her. I appreciate the opportunity to be here. I looked back and we both weren't at the last meeting. Lydia had a well-deserved vacation and I had a family commitment. So I'm sorry we weren't able to be there. And I see in the notes, Tim mentioned our funding, which you've all heard me and Lydia refer to. And we have been waiting to get the final answer, although we were told around Christmas, holiday, New Year, that our funding would revert back to the $125,000 a year annual allocation. We had 29 months of $250,000, almost 2.5 years, which enabled us to hire Lydia, pay Fringe, and do some really great work. In my own intersection of life, knew and spoke to BSAS that I would be planning to transition as the new contract period approached, especially as we are uncertain with federal funding. So for me, I started in 2008, and I've been a privilege to work in Needham since that time. And I've always been funded by federal dollars, either discretionary grant or block grant dollars. I look at Stephen and Ed and the days where we had in-person meetings at 7 a.m. I've learned so much. It was a privilege to work in Needham and be exposed to public health because my background was addictions and school guidance. So I have made the decision that I will be ending as our fiscal year ends, June 30th, as our funding winds down. And after the Labor Day holiday, I'll figure out what I may do part-time in prevention. But it's a good time for me to make that choice. It was something Lydia and I and Tim have talked about in anticipating. So June 30th, I'll be done, and Lydia's ready to lead our 4 towns. And I'm just grateful to you all as a board. I know you've heard me speak up, maybe speak out, and say that I have used the leadership and the knowledge that I've gained personally from Needham to serve on my own small Board of Health through Medfield. I'm speak for my Board of Health when we thank you and Needham as Board of Health members, and of course, Tim, for sharing resources. And then the big transition was taking on the shared services. So I've benefited personally in knowledge and privilege and professionally, of course. So June 30th, I will end. And I just thank you all. And I know that this isn't a goodbye, it's more of a change. And like Tim and I spoke, I'll figure out after Labor Day what I'll do. But I thank you all, and I know I'll continue to thank you because I'm still also going to be a Medfield Board of Health member. So I'll let Lydia talk about our work, but thank you.
We're going to have a little something for you, aren't we?
No, because I'm really not leaving all the, exclusively.
Okay.
So you're so nice, Stephen. And we used to, now Tim will roll his eyes. 7 a.m., we'd have our meetings, snow, sleet, rain. Amazing. So thank you. And Ed and all of
Carol,
you.
it's been an honor and pleasure to work with you.
Absolutely.
Thank you.
And I'll
Thank
continue
you.
working with you, I assume, on Charles River.
Oh, yeah. So thank you. Thank you all. Thank you.
Thank you, Carol.
Carol.
And we look forward to continuing to work with you. We're not going to let you off that easy.
Well, ever since Tim started, I've been, I'm a grandmother, a mom. I say to Tim, do you mind if I talk? Do you mind if I raise your hand? He's been a great mentor. He's like, nope, go ahead. So it has, when I say it's been a great learning experience for me with our Board of Health exposure, but also working with Tim. He's done so many great things and taught me a lot as we've written grants and gotten funding for things. So he's probably turning red, and I really will mute myself now.
bright red.
He does look red.
Thank you, Carol. Well, I do have it in the minutes from Steve that we have to have a little something. It's going to be summer, so we can't just say goodbye to you just like that. No.
I'll be around, and I'll let Lydia give our update.
Thank you, Carol. Lydia,
Thanks.
over to
It's
you.
been an honor and privilege for me as well to work with Carol and learn from her as a mentor. And I think she has left me well prepared to manage our grant in her absence. I want to share good news that the town of Westwood submitted a drug-free communities grant application last month. And if they are awarded the grant, each of our cluster towns, Dedham, Walpole, and Westwood, will all be drug-free communities grantees because, as you know, we supported Walpole in completing their application last year, and they were awarded the grant and able to hire a program director this fiscal year. So we've been spending time over the past couple of months working with Kelsey Ober, Walpole's new Drug-Free Communities Program Director, and May Mears, who is Dedham's new Drug-Free Communities Program Director. Dedham has had the grant, but May is just a new program director who started last month. We've been spending time with both of them. We've also been preparing for our annual regional Mass Call 3 meeting. The meeting will focus on primarily sharing four-town youth substance use and mental health data from the Metro West Adolescent Health Survey, as well as updates on our regional strategic plan implementation. It will be co-facilitated by our contracted evaluator, Jess Goldberg from Prevention Solutions at EDC. And Carol and I have requested and received data crosstab reports from the 2023 Metro West Adolescent Health Survey from the four towns that crosstab mental health and substance use indicators. So we've asked for reports on past 30-day use of cigarettes, vape products, alcohol, marijuana, and prescription drugs by students reporting life is very stressful, depressive symptoms, self-injury, considering suicide, attempting suicide, and generalized anxiety disorder across middle and high school. And the data reflects statistically significantly higher rates of mental health symptoms among students that indicate using substances. So we'll be presenting that data. I'd be happy to present it at a future Board of Health meeting too. We can discuss and prepare for that. And we're working to collect additional four-town data, police incident data, EMS data, and hospital emergency department data from BID Needham and Newton Wellesley Hospital. The police incident data that we've collected in the past and that we're requesting includes overdose, possession, minors in possession, providing alcohol to minors, operating under the influence of drugs and alcohol, and protective custody. And hospital data includes falls, injuries from domestic violence, suicide attempts, self-harm attempts, other mental health conditions, acute intoxication, suspected overdose, and concussions and suspected concussions. So I know that was a lot and a lot of information on the data request specifically, if anyone has any questions.
Thank you, Lydia. Any questions for Lydia?
Thank you.
Thank you. Okay, do we want to move to the next item, Tim?
Yep. So I think Karen, you're up next.
Thank you. Good evening, everyone. Nice to see you all. Our main talking points from the month of April are several, which include some SPAN activities. We had a in-person social host law presentation at the high school last month, where we had several really great speakers. Some of you may be familiar with John Sophus Sheft from Law Enforcement Dimensions, and we also had Needham Deputy Chief Chris Baker, a longtime SPAN member, speak about the social host law from their respective lenses. And we also provided a overview of how parents can take that information about the social host law and then talk about it at home with their tweens and teens. So we were really pleased to be able to partner with the high school principal, Aaron Seacott. He came as well to co-facilitate with us. And we had that recorded, and we shared that recording with the high school so that we can reach parents digitally, because we know that that information, particularly this time of year around prom and grad season, is really important. We also partnered with the police for the Spring Take Back Day on April 26th. And we, on that day, collected 54 pounds of medications from the community for a total of 447 pounds collected over the previous 6 months. The combined total was 447. Angie McDonald, our peer recovery coach, has been working full-time now since that position was approved, and she has been really busy in terms of the different things that she's looking at with respect to our opioid settlement funds, as well as doing things in the community around the Dual Recovery Anonymous meeting and Narcan training, for example. And then lastly, on our prevention front, the STOP Act grant completed at the end of April. There was a 4-year grant, as you may know, that we accomplished quite a bit of alcohol compliance work. And we actually had Scott Formica create an evaluation report of the 4 years of alcohol compliance work, which I'll be happy to share with you in the future. But we were very, very humbled to be able to do this work over 4 years. And then finally, I wanted to mention that our SALSA students have been extremely active this spring. And I have it listed here in the report, so I won't read it all, but several members received awards recognized for their leadership, including Surya Keshava, who won the Massachusetts Statewide Leadership Award for her prevention work in Needham, and Kalina Mahova, who you met this evening, who presented comments to you. She received the Norfolk County Community Commitment Award for creating positive change in the Needham community. And while those two in particular are named, there were a number of other SALSA students who contributed a lot of their time and advocacy during the month of April. And I'll close out with one other mention. I provided in my at the end of my status report a follow-up from the discussion at last month's Board of Health meeting about nicotine pouches. It was during that meeting that we had presented a nicotine summary to the board, and it was requested that we dive a little deeper into the Metro West Adolescent Health Survey data from 2023 to look a little more closely at the disparities in use of electronic vapor products and cigarettes reported by our Needham High School students. So you'll notice at the end of my status report, there is a chart there that I want to thank Julie McCarthy for helping me with that. And it does show disparities in use among EVPs, electronic vapor products, among those students who identify as LGBTQ+, across racial lines, and also students who report having a learning disability or physical disability. So you'll see the p-value listed there.
Sharon, on the physical versus learning disability, because you have the physical disability right above that,
yes,
with a non-significant p-value, is it safe to assume that it's really just the learning disability where that is coming from? Because that's the one that's above.
Right.
Right. And that one's, obviously statistically significant. So
right.
You're just pooling these two together. It's a little hard to tease it out otherwise.
Yes, I agree. Unless Julie disagrees with me, I would tend to concur that it was really the students who identify as having a learning disability where we see that p-value of statistical significance.
Thank you.
Any questions that I can help you with?
Yes, given this data, and also regarding the end of the grant that you mentioned earlier, how do we plan to fund this program in the next coming years?
I'm sorry, are you inquiring about the work that was done during the STOP Act grant?
Yes.
So it's a great question.
Yeah, it's going to end during the end of this year. I heard one of the grants is ending, so I was just wondering if this work is supported by that grant, how do we plan to fund it in the next few years to come?
So if I understand you correctly, you're interested to know about the work that we have been doing under the grant that has ended as of last month.
Yes.
So we're fortunate that our town, particularly our relationship with the police department, is very much in favor of continuing the compliance work, which was the bulk of the work that we did during that grant. And that compliance work included the alcohol compliance checks that the police conduct several times a year, as well as the responsible beverage service training that I feel fairly safe in saying that we will remain committed to continuing that work, that training. In fact, we have one scheduled on June 2nd. So our hope is that we'll be able to keep that momentum up. We have trained additional people as certified trainers in responsible beverage service training. So that will help too, to have people here in the community who are already, much like Carol Reed did for many years for our tips training. We have, in fact, Carrie Donnell, there she is one of the individuals who was trained last November in the responsible beverage service curriculum that we're using now, which is Serve Safe Alcohol.
Thank you. Any other questions for Karen?
Karen, that was a much better answer. I was going to be that it was my job to figure it out, but that was much more thorough. Thanks.
Thank you, Karen. Thanks for the update.
Caleb, I think you're up next.
Good evening, everyone. So I am going to highlight one activity, which is about the MRC. We have started planning for the Volunteer Day, which will be in September, aiming to for about 60 participants. For now, topics will include incident command system, family preparedness, and to have a couple of guests. From last year, one key takeaway from our volunteer feedback was that they want to the chance to meet each other across the NC8 communities, so they can have like a team building activities. So we are going to include that into our agenda for this year. Also, some good news, NACCHO confirmed that for year 25 grant check are starting to go out next week. So that's my update.
Any questions for Caleb? Thank you.
Okay, I am going to be giving the epidemiology and the nursing update because Ginny and Hannah couldn't be here tonight. So I'll start with my epi update. And just a couple of things that, we discussed the rat reporting survey at the last meeting. I shortened it based on your feedback, so I thank you for that. We've already received a handful of responses, and we're continuing to advertise it. I'm sort of like plugging it into Facebook threads and things like that to make residents aware. And I'm working with Tara and Sai and Alexandra on an educational sort of website about rats. And our hope is to include this rat sighting survey data sort of de-identified on that site so that people can understand the problem areas in town, sort of why we respond the way that we do. Biosafety updates, all of the permit renewals have been submitted and all of the lab inspections have actually been completed at this point. The Biosafety Committee met last week and we are all on track to have the permit renewals approved by the end of the month. This year was much smoother than last year, I think. And again, just as a reminder, we had one company close this year. So we have 4 companies in town at the moment that have a biosafety permit. From a nursing perspective, I was I was told to give a couple of specific updates on their report. Notably that Hannah's position has changed, so she's no longer technically a part-time public health nurse. She is now special assignment support, to be very technical, and she's focusing her time, which is more limited now, on domestic violence committee, heart safe, CPR classes, and matter of balance. And on the note of heart safe, we've begun filling out the application to become heart safe certified. And we've accomplished most of the criteria, but there's one specific criterion that calls for the integration of our AEDs via this PulsePoint app into our 911 system, and our system needs to be upgraded. That requires some money. So we're working on that. We've talked with Tim recently about this, but until we can do that, we won't be approved, was what we were told by the HeartSafe folks. So that's it for me. If there are any questions.
Yeah, HeartSafe, is that an AHA or American Red Cross program?
I don't think it's, I think it's Citizen CPR Foundation.
Okay, I mean, the reason I ask is just my brother's very involved in Red Cross, so, and EMS types of things. So if it's a matter of, you know, some technical expertise, he might be able to offer some, and I could contact him.
Okay, no, that's great. Yes, I think it's Citizen CPR Foundation is what I'm looking it up online.
I think the idea seems great. The pulse point, so that, for example, the general idea is that when an emergency call comes in, the locations which are assigned for AEDs, the GIS information would basically automatically pop up for a dispatcher, letting the dispatcher know where the closest AED is. So it seems like it would be quite valuable. Hannah's been working with Jonathan Steves, the EMS coordinator for the fire department, and their head of dispatch, Diane. So we're going to talk to the chiefs, and we're going to see whether that's something we could find money for in the short term, or whether that's a new budget request. It's a fairly large one-time cost and then very modest annual cost.
It's good.
Yeah.
Any other questions for Julie?
Oh yeah, I'm looking. My brother is actually on the program advisory committee on that Citizen CPR page. You scroll all the way to the bottom. He lives right here in town. So
maybe a little consideration from Jonathan would help. Okay.
Worth talking to him.
Absolutely.
Harry, I think you're up.
So sorry. Again, caught. Oops.
We can hear you.
Okay, thanks. I saw the screen sharing and I lost all visual. So there we go. Sorry about that. Hello, everybody. Let's see. So for Shared Services and Training Hub for the month of April, largely, we've been very busy. One update from May is that Sam Menard, who was the assistant manager and lead trainer, submitted her resignation. I think it was technically May 9th. She is leaving us to join the town of Dedham as public health director there. And we're already missing her terribly, but very happy for her. You know, it's a great opportunity for her. This does mean that we are now down 2 staff. We have, let's see, we have the regional environmental health agent position, and then there'll be this position. And I have actually been talking with Taylor from HR off and on for a bit, and spoke to her this week about getting those positions posted, and they're eager to work with us on that. So that does mean that with both of those folks, with both of those positions empty. We will be limited in the service that we can provide to the communities in terms of inspection backup. So we're eager to work on getting those filled and get folks be able to provide that support again. For public health nursing, the regional public health nurse role, Jen Gangadaran continues to provide coverage for Maven for the town of Medfield. Their position for the public health nurse remains open. I know there's been a variety of candidates, and they're looking for a good fit. I believe the position is a 19-hour a week position. So thankfully, we do have Jen on board, and she is able to provide that Maven coverage. She, has provided coverage, was providing coverage for Dover and Sherborne at one point, and Medfield, and I think is providing some coverage for Needham actually this week. So it's one of the benefits of shared services to have that available. Jen also has worked with Gail Varsa, who is the public health nurse for the towns of Dover and Sherborne, and they did a hands-free CPR offering at a employee fair for Dover Sherborne, and it was really well received, and they've shared the information with Medfield, wanting to let them know about it, and offer to provide some simple training on that as well. That originated here in Needham. I believe it was Hannah who brought the program in and showed Jen Gadarin about it, and we were able to grow it then out to the other towns. So nice example of the way we can extend the reach of things. In terms of training hub, Pat Martin and Jen Gangadaran continue to they're on their journey to become certified as public health housing trainers. There's been a little bit of scheduling challenge, and so I think that is Pat should be certified July, I think, and we're trying to identify the timing for Jen as well, and that'll be great because then we'll be able to offer some workshops with folks in the 43 communities that we serve. One of the things that the trainers are offering is a workshop on how to do proper report completion for housing inspections. And it's something that towns have identified as a real need. So we're looking forward to be able to do that. We are going to provide a de-escalation for inspectors training that will happen in June, but we're able to identify a vendor who will do sort of a custom training workshop with us, and we'll be sending out a note to all of the communities and hoping that folks will be able to take advantage of that. So there are a number of curriculum that are projected to be developed. One of those is camps, and that it is in development. I'm not sure quite what stage they're at. It's not going to be ready for camp season, right? In anticipation of camp season, Jen Gangadaran has been working with Ginny and learning about camp inspection practices as they are right now. And then as soon as the curriculum is available, Jen will start taking that so that she can become an inspector trainer for that role. So we're hoping in the fall. I think that was the thought. It's too bad it couldn't be ready before camp season, but we can't win them all. So, thanks to Ginny for being able to help Jen G get on board with that information. And I think it'll be a good opportunity for us to work with the towns on how does this work this year, and then we'll see what the new curriculum offers. And then I'll say two more things kind of at the administrative level. So for Charles River, the strategic planning work that we've been doing since January is proceeding nicely. There's a draft report that I think will be coming to the advisory board in May, and that'll set some guidelines. We're trying to do some work to get as far as we can on a community health needs assessment and identify from data, what the public health priorities and needs are. We'll use the Foundational Public Health Services results as well, and the priorities that we've identified in that strategic planning process. And then I think the last thing is just worth of note. So our funding is state dollars, a combination of state funding and ARPA dollars, right? And we are in the fortunate position of feeling, fairly secure with those dollars through 2027. We have had to do some work because of some impact at the state level from other funding sources that are not secure or federal. We have had to do some work with Office of Local and Regional Health during April. Jen Casey and I have been working on reworking budgets and looking into being able to calculate exactly how much money we would be spending and what dollars could we forego from the training hub budget specifically, because we did not have the ability to spend it all, and there were some programs at the state level that benefit local health, and rather than doing our best to try and spend it all and then return what we couldn't on June 30th, we worked to identify this is really exactly what we'll need, and the other dollars we're not going to spend, and we would make that available for the Office of Local and Regional Health to work with. So it's been a big piece of work, and that's why I thought it was important to note. It's one of those things that happens behind the scenes, in addition to how do we provide good service to all of our towns for the public health services. So that's all I have. Anyone have any questions for me? Thank you.
Thank you, Carrie.
So, Madam Chair, we are at the designation of agents portion. Every year, the Board of Health sort of renews its designation of agents, which is where it sort of authorizes myself and other members of the staff to act with the board's authority in specific circumstances. Usually that's sort of acting imminently for sort of an urgent public health hazard. So if a restaurant was having a major foodborne illness outbreak, to shut the restaurant down. If a home was unfit for human habitation, it would be the finding that the home was unfit. All of the sort of access and use of the board's powers does come with sort of the ability for anyone who's affected to appeal to the board or to have a full hearing in front of the board. But given that the board is all volunteer, there's value in sort of having the board designate staff to be able to act on its behalf in the moment. The board has historically done this once a year in the spring, and there is a suggested motion that's in the packet. I don't know if any of the other board members have questions or want to discuss it.
Anyone wants to discuss this topic in more details?
No, this is an automatic thing, really.
Yeah. I'll go ahead and make the motion that we support the designation of agents as stated in the packet.
I second that.
The motion is passed.
Well, we need a vote.
Sorry, Steve, and okay.
No, just we need to vote, that's all.
Please. Yes, can we all vote, please? Show of hands.
Okay, so that's unanimous. Thank you.
Sorry about that.
We also have in the packet, and we've historically done these together, a public health division charge. There are occasionally topics in the town that are politically sensitive, although sometimes they do have an impact on health. And I think, one of the earliest examples was in whether to, at a state level, legalize recreational marijuana, not just medical marijuana, and whether the town of Needham would move to permit recreational marijuana instead of just medical marijuana. But certainly there's been other issues that have been politically sensitive in town, including accessory dwelling units, especially when they were first proposed, back in, I think it was 2018. So the board usually submits a letter to me with a CC to the town clerk, in this case, Ms. Miller, where it sort of basically is charging the public health division to follow the data and the science and to, while respecting the appropriate state laws and rules around ethics about acts of public employees, but it should work to inform the community at large and elected and appointed officials about the public health impact of policy decisions. So knowing that housing is a key social determinant of health, there's impact when the town moves to expand opportunities for housing that would be positive generally for health. So the idea is that every year the board sort of reiterates that it's the job of the public health division to produce information and give people tools to make decisions that improve the health of the community.
So I'll make a motion that we adopt this.
I'll second it.
Can we have votes from the rest of the board members? Show of hands, please. Okay, thank you. 0. Yep. The motion is passed.
Thank you. Get it. I think we still have Tara and Sai and Karen. And I think they were going to talk a little bit about Article 1 nicotine pouches. The board did make major changes in November, December with the nicotine-free generation choice. One of the sort of pending items was, does the board want to do anything with nicotine pouches? The board at the time basically said, let's take the whole section out and we'll figure that out later. The options would be to sort of continue where it is now, to potentially restrict nicotine pouches to adult only, or to not allow the sale of nicotine pouches at all, or potentially some third option that might get into what the dosing is. There's nicotine pouches are a new sort of field, right? If you think about the changes in the tobacco industry in terms of flavored products and vapes and sort of that thing, nicotine pouches appear to be sort of the newest iteration that is very popular. So I'll turn that over to Tara and Sai and Karen to present.
Okay, I can start. Just basically, we wanted to provide you with 2 versions of the revised regulation red line edits that we've added in there. One has the nicotine pouch limit, and the other one, so section G was put back in, where we put the nicotine limit under one section, and then the other version of the reg shows that nicotine pouches in adult only retail stores. And if you have other things to add, Karen or Sai.
Thanks, Tara. I think really we just wanted to, as Tim was saying, follow up from the conversations that we had back in December, early January, and see what the board's consideration is at this point on nicotine pouches, and being able to just provide a couple of different options of redlining the tobacco regulation, Article 1.
So from a practical standpoint, right now we have a flavor ban. I'm not aware of any Zyn product that is unflavored. Am I correct in that? I'm sorry, am I correct in that assumption?
That there's no flavored Zyn?
Correct. That there is no unflavored Zyn.
Oh, unflavored. Correct. The flavors are not a lot. Yes, correct.
Right. And right now there's no product on the market that is unflavored. So for all practical purposes, Zyns are not being sold in our town.
Sai, do you want to weigh in on that?
Yeah, I can. So the only one that we've tested that we felt comfortable determining was a flavor, or was a product that had a characterizing flavor, was the Zyn Chill product. There's another product called Zyn Smooth, which it wasn't clear whether it had a characterizing flavor or not based off a smell check or the testing that we had done. So that product's just unknown because it's such a gray area. It does have a sweet flavor to it, and other towns have stay the same thing, but it's a gray area kind of product. So we haven't really done enforcement on that particular product. And there's also other brands that do have nicotine pouches as well that sell them. And we haven't tested those other brands. We don't know if they have characterizing flavor or not to those other types of pouches that are there.
Okay, so, well, all right, so here's one thing. The FDA now has taken the authority to actually approve these for sale. So we could say that the only ones we're going to allow for sale have to be FDA approved. That's hurdle one. Hurdle two is they have to be unflavored, right? No characterizing flavor or odor or what have you. If that's the case, the only one that's even possible right now is In Smooth. Everything else comes off the market.
And I would be in favor of adult only as well.
I am
Well, it is
too.
all adult. Well, with adult only stores, we don't have any. Right, so that's the big question, because then you're effectively banning them.
Well,
And then the question there is, I mean, look, we have tobacco, we have nicotine-free generation. Supposedly they don't have access to these, at least in our town, period. And now you're really limiting, what they can even sell. And my guess is that Smooth, when we figure out the testing, the same thing with the vapes, right? Is you're going to find something there. So it's, and I think the last time we went about this, I think it was, Rob and I felt that, look, there are some people who may use these as a cessation product. You could also make the argument that, there are cessation products out there already available in pharmacies for people who are really interested in doing that. And all told, the risk, exceeds the benefit for allowing these on the market and need them at this time. I mean, that's what we're here to decide, I think.
Can I have a clarification? Because I thought with the nicotine-free generation, did we not include pouches, or did we? Or maybe I missed.
They're included.
They
They're
are.
included.
Okay.
Yeah. So anybody, who was born after, January 1st, 2004 cannot purchase ZYNs in our town. But it sounds like there are a lot of other, competing products out there. So, those shouldn't, those we could just, close off by saying anything has to be FDA approved. I assume they're going to approve more, but, that kind of buys a little bit of time and see if the state acts.
Is there anything that's going on at the state level in terms of restricting these products in any way?
So I don't know what's going on. I don't know what's included in the nicotine-free generation bill. I can take a look for it. I know it's been introduced. So let me just, see if I can find it under MGL real quick. Unless Tim, I don't know if you have that information.
I don't have the number off the top of my head. I believe it was introduced in the Senate. I assume they've lined up a corresponding sponsor in the House, but I'm not positive.
Yeah.
Okay.
And I do feel like there's plenty of other tobacco cessation products out there.
Yeah, so here it is. At least I've got the Senate bill because it'll be the wording that we're interested in. Read the proposed bill here. Got it. So it's Senate 1317. Jason Lewis. So it includes it does not ban nicotine pouches. It's really pretty pure in terms of just the age. So basically anything that's a tobacco product, and it's very broad as to what includes a tobacco product, wouldn't be able to be purchased by anybody after such and such date. I mean, they're using, they have this going into effect essentially in 2027. So anyone born on or after January 1st, 2006 is what they have this in for right now.
Can I ask for a clarification? So the nicotine pouches, they advertise as they are tobacco-free products. So if that's the case, then will the current bill indeed include the pouches as well? Sorry.
Well, it says including, but not, so Nicotine product is a product containing or made or derived from tobacco or nicotine that is intended for human consumption, whether smoked, chewed, absorbed, dissolved, inhaled, snorted, sniffed, or ingested by any other means, including but not limited to, and I could go on.
Okay,
It's included.
Okay.
Now, I mean, this bill does, it says nothing in this section shall preempt further restriction by the Commonwealth or any department, agency, or political subdivision of the Commonwealth. So
Okay.
we still have the right under Chapter 111, even if this passes, to say, you know, something, we're going to ban them outright.
Mhm.
I mean, Ed, you've been the fiercest critic of, prohibition.
I am, because I don't think prohibition works. But I suppose we shouldn't do the adult stores since we don't have an adult store. That is effectively prohibition. So I suppose we should leave that out. But otherwise, I think everything else is fine.
So Ed, just to clarify, are you referring to removal of any language from the existing article that we have in the package?
Yeah, remove the language about adult stores.
Okay.
So it would be potentially the version on page 61 of the packet.
Yeah, so it would limit it to 6 milligrams or under, which is, the maximum that FDA approved. And I would further limit it by adding something and say they have to be FDA approved for sale.
Okay. So part of this discussion, part of this discussion was just to understand where the board is, and to make sure we knew what the board wanted a red line to include. With that information, then we would advertise a public hearing either for June or for July or August, depending on the board schedule.
I think you either do it in June or September, because otherwise people will argue that nobody's here in the summer.
That's a good point. Okay.
The other thing, just from an information standpoint, do we know what, Newton has a nicotine-free generation. Now Wellesley does not, but Newton does. What are they doing about Zims? Have they banned them?
A good question. And obviously Brookline does too. So we should try to
Check.
have answers to that. Yeah.
Yeah, because most of the other towns are, either on the North Shore or I think Pelham is kind of, the one outlier.
Yes. Yeah, most are in the sort of Melrose, Wakefield
area. Yeah.
Yeah.
So if we go the route of the first version, which is to limit the sale to 6 milligrams, and we also include language that would have to be products that are already FDA approved, I would also support what we talked about at the beginning of the meeting about specifically stating that the oral nicotine products would be unflavored, specifically, in addition to the letter of certification that they have to send. And also that before retail sale in Needham, we evaluate the board or the board's agents evaluate these products to confirm that they are unflavored.
Okay. Makes sense.
That's good. As long as we have a standard protocol we use for determining whether they're flavored or not.
So I think what we would do as the Public Health Division is come up with a draft policy and procedure for the board's review about how a determination is made and how it's consistently followed. And we can review it with the board at the June meeting. We'll go over with Cheryl Sabara from MHB and as well as Chris Heap, Town Council, the suggested language. And we will produce a red line, although it won't be that hard because we're just doing a very small section. And we'll advertise for a public hearing in June if that's the case.
I would also suggest, not necessarily for this, but this is a really good program possibly to involve the shared services communities with. Because my guess is what could happen is we're going to have a lot of a lot of the vape, I mean, it won't be the Zins. There are only 20 FDA approved products. Most of them are flavored, so that's not a question, right? So there are only going to be like 2 products that they're going to submit to us. The chill we've already ruled out. The smooth is going to be the tough one.
Yep.
But every vape product that's out there that has a flavor, that they produce something new, they could flood our department with hundreds of these. Right. And some of the determinations I think would be pretty quick, but we don't want to make a lot of busy work. And they could just try to do that just to say, this is impractical. You're never going to be able to keep up. But it's going to be a lot harder if we have, 4 or 5 surrounding towns that have passed nicotine-free generation, all sharing the data. So that, if it's banned in one town, basically it's banned in the others as well, because we're all doing it together.
That's for sure. I know,
We
Carrie,
could even come to an agreement with Newton and Brookline for that matter. If we could negotiate something like that.
I certainly think that would make some sense. I know the other communities obviously have less resources for tobacco compliance, but I do think that that was an area where we had interest. I don't know if it's 100% exactly the same, but there was interest from Dover and Sherburne, and I think from Medfield to have a similar process and to also look to implement tobacco compliance checks in the way that Needham does with underage buyers.
That's correct. And we did talk about this, I think at our last strategic planning meeting. There are sort of where each of the communities was in terms of taking up nicotine-free generation or any other kinds of things. And not all communities were considering that. So we didn't get it further into the would they be or what was the motivation? But so point being that the policies may be different. But yes, I think that the shared service, it is a topic that we have discussed at shared services and will remain a priority for our work next year.
Because here it doesn't even need to be nicotine-free generation. This is really just how are we determining characterizing flavors, and do we agree that if one town states, we're comfortable enough with the processes, and if one town says, yep, it's got a characterizing flavor, the others will automatically, agree with that and exclude them.
Right. And I think, and I was using nicotine-free really just as an example of it's not necessary that we will all the communities will have the same, they may not have a provision about that, about this. So, but absolutely, I think bringing it to them and having that conversation about how implementation could work makes a lot of sense.
Okay, so I think we have our marching orders then.
Mm-hmm.
Okay, we'll come back with a policy and procedure for the board's review next month, as well as the draft red line that we discussed, and we'll make sure we run it by town council and MHB as well. And then we'll also come up with a list of what some other nicotine-free generation communities and other surrounding communities are doing for characterizing flavor.
Yeah, and which ones have banned them outright?
Yep.
I don't think we want to be the one outlier.
Understood. Unless there's additional discussion on that, I believe we're to our second to last topic, Madam Chair, and that is fees. The Public Health Division staff worked fairly extensively, and we did have some help from a consultant to look at the time and effort it takes for us to process permit applications and to conduct inspections. And next slide is going to be very hard to zoom in on. This is a PDF page from a dynamic model that's in Excel, which we're happy to share, where we took that information in terms of the amount of time it takes to process something. We really sort of dove into, what are the full costs for an employee's time, including, benefits and indirect and that sort of thing. How much in the way of supplies are used? If we're using software, is that, what is sort of the fractional amount of usage based on the annual cost for the software? And what we sort of found was we are overcharging in some areas and we are undercharging in others. In general, not entirely, but we are undercharging our food service establishments by quite a bit based on the amount of time and effort that we put into permitting and inspecting them. We are undercharging in some cases, other areas, including installer's permit for septic, some of the pool categories. We're overcharging for those other categories. Undercharging food, overcharging for example, some septic categories, some pool categories. The marijuana treatment center, for example, it looks like we're overcharging almost by 50% in some cases.
So Tim, what I didn't see here is when you add up all the permits that we approved during the course of the year.
Yep.
What was the income for the last year?
Yep.
And assuming that they were all to renew, what would be the expected income this year under the new rubric?
So, and I don't have the exact number, but the difference was about $1,800, and it was $37,000, excuse me, with the new fees, and $35,000 with the current fees.
Oh, so pretty comparable.
Very close. And obviously the board is not trying to make money. It is trying to potentially recognize the appropriate cost effort. And I think the reason we're doing this is just historically, we've taken a look at what our fees were. We've asked neighboring communities and we've sort of said, oh, it's been really complicated to do septic. Maybe it should be a little bit more expensive. And over the years, our permit fees have sort of drifted a little bit unmoored from a real factual assessment of the costs that are really truly borne by the department.
Right. I think, and this is a logical approach. So I think this is a good idea.
I think the one sort of wrinkle I will throw out is that there are a number of situations where food service establishments are feeling stretched in terms of maintaining staffing, in terms of on-again, off-again tariffs and their impact on certain food items with inflation. I know a number of restaurants had concerns, not about Skip the Stuff, but about the ban on black plastics for takeout containers, which was passed by town meeting. So I think one of the questions for the board does it want to phase in an increase, or would it want to, do a sharp increase? I think the added wrinkle potentially, is we had been hoping to think about going to risk-based inspections. And I think that kind of complicates the discussion a little bit. Tara and Sai, do you want to go over what risk-based inspections are and would do?
Well, the amounts I saw were considerably more. And my question is, how are you determining which restaurant is at which risk level? And then there are some, like the schools and the hospital, that you're giving a freebie to, despite them being, potentially at a very high risk, like the hospital.
Yep.
Yeah, I can give a quick overview. So as part of our standard FDA retail program standard adoption, standard 9, and we've been basically following that standard, and it had us break down all our restaurants into those different categories, which were already set up. It's in our food code enforcement policy. So they're saying like nursing homes, for instance, would be inspected 4 times a year, or more highly susceptible populations. I know the schools aren't part of that, because they're the town nonprofit type situations where, we don't have them in that category. But that's where it comes from. And a lot of towns that have adopted the FDA standard have broken down their fees into these risk-based fees for the establishment.
Right. Yeah, I mean, it makes sense. I mean, my suggestion would be you phase this whole thing in over 2 years. I think that the only trick there is there are going to be some people whose fees are going down who are saying, well, if you're admitting that, it doesn't cost you this much, why are you charging me an extra 50% this year? It's because we have to balance the books for everybody else. We can't take a 25% hit on fees, I don't think, Tim.
So we can. The board can choose to set the fees at whatever level it believes is appropriate. And it can choose, for example, to, for lack of a better word, subsidize food service establishments if it wants to. I do think that, one of the concerns we have is the food service establishments that seem to be operating the closest with the tightest margins. That's where we see people cut corners. That's where we see food safety start to fall. So I think both as a sort of humane thing, but also as a hopefully enlightened self-interest thing, I don't want to squeeze restaurants too tightly with a new fee if that's going to mean they have one less person on shift who's trained, or they, try to get away with kind of cutting some corners in terms of hot and cold holding, or keeping temperature logs, or that sort of thing.
I mean, I think this exercise was good to understand the workload, work effort, all of that. But I also think, we have the ability as a board to think about cross subsidization for some of these businesses that are potentially struggling. So, do we want to even talk about not increasing for food establishments and think about that cross subsidization or something like that?
Yeah, but I mean, look at the amounts. These are not large amounts. I mean, I understand they're tight, but we're talking an increase of, from $300 to $600 for a year. That's not going to cut, a worker. All right, $300. I mean, that, it's a little
But
bit of.
I think it does need to phase. Otherwise, it's like 100% increase, right?
Oh, no, absolutely. I agree with you. That's why I was saying, I might want to phase this in over a couple of years. I just want to make sure our budget can if our budget could handle it, it would be great to give the decreases immediately and to phase in the increases over 2 years. So 50% of the increase for the next year, and then the remainder the following year.
So I did speak to the deputy town manager, and I'd like to make a joke about how the Pollard rebuild will fail completely if they don't have the $32,000 from the public health fees. But the budget does not really rely on public health fees to do much of anything. So if public health fees went down from 35,000 to 34,000, 33,000, 31,000, it doesn't make an appreciable difference to the town. So it's more of a policy determination by the board. There's not sort of any fiscal demands really from the town.
Right.
So
Well, I mean, that depends on how much of the budget is made up from food service establishments, Tim, right? I don't know how much it is when you run the numbers.
So we don't retain any of the revenue that we take in permit fees or fines. It all goes into the general fund. That's partially why the deputy town manager sort of said, the board needs to make its determination as a policy matter, not, we're not locking the board in that it has to bring in this amount of money.
Right. So, I mean, if it helps, I would make that as a motion.
I think we should phase it in over 2 years.
Okay, but we would do the reduction for anyone who is being overcharged. We would do that sort of immediately.
Yes.
Okay.
Yeah.
Well, we could also do that over 2 years.
We could, but how do you ethically tell people, hi, we're going to overcharge you again for a year?
Yeah, that isn't justifiable.
That's why I think you've got to do. That's why I think you've got to do the reductions immediately and phase in the increases.
Yeah, I agree.
Yeah,
Rob, you're troubled by that. Why?
Well, I mean, if you use that argument, people could say, well, we've been overcharged, for years. When are we going to get a rebate? I see your.
Sorry, no backsies.
There is a policy for that says no backsies. Yep.
So, Tim, this evaluation is conducted every every year or?
This is the first time we've done
Okay.
it this thoroughly. In the past, we've sort of taken the fees that we have. We've looked at, we've asked Wellesley what they do, we've asked Newton what they do, and we've sort of said, oh, well, our tobacco fees are high, but that's also because we do 4 quarterly, we do compliance checks and we do underage buys, and we switch it up. We have 2 buyers. We have the police help us with those. So we sort of looked at the outliers and said, yeah, that we understand why those are outliers. This is the first time since I've been here where we've done okay, how many hours did you spend on this inspection? How many permits did we issue? What was the cost?
We used sort of a seat of the pants approach to this in the past.
Yeah, so to the no backseas rule, I mean, this is completely different system. We reevaluated how we're doing this. Here are the new fees. There's going to be some winners, there are going to be some losers based on this. We know that. The winners, we're going to reward you immediately. The losers, we're going to phase this in. But from a policy standpoint, we think this is a fair system because it properly allocates for the amount of effort that it takes in order to do the actual inspections and permitting.
I agree.
Yes,
Yeah, so at the end of the packet, there's like a spreadsheet with a bunch of numbers, and then there's green and red there. And on top, there's like numbers that indicate the risk level of restaurants, like 1 through 4. So those numbers don't really match the actual time that we spend on permitting and inspections for those risk levels, because like risk level 4 would be over $1,000. So we actually reduced that and try to compare it to other towns that do have a risk base fee schedule for the restaurants and food establishments. And then we looked at like Manfield and Somerville, Winchester, other towns that have been following the FDA retail standards, and kind of base those values based off the other towns that do have a risk-based fee schedule for the restaurants. So we try to when we came up with these numbers, we try to make it so like it kind of like matches at the end, there's only a nominal increase in the total fees collected. I think it was like Tim mentioned, it was about 1,500 overall, but there are some substantial like increases and decreases, but it doesn't cover all the costs of permits and inspections actually, but it will help cover those costs. And I think switching over to a risk-based fee schedule will be beneficial, because if let's say we have issues with restaurants, we're able to increase the risk level, and it will also increase the permit fee overall for the next year, because we'll be spending more time with those restaurants anyway.
So am I gathering the maximal increase here I'm seeing, I think, is $200?
There's two establishments that would have a $350 increase.
Yeah, but that's North Hill.
North Hill and Yummy Sushi. That's the only other one.
Which is Sudbury Farms.
Right.
I mean, which are relatively large establishments. I'm looking at, Sweet Basil, which is, relatively small establishment. And what was the other one that had like a $200 hit? I think it was Hazel's, both of which are, pretty big, institutions in the town. But even so, we're not talking, I mean, yes, it's a big increase. It's not a lot of money. I mean, I'm still fine phasing it in.
As a comparison, if we went with this as opposed to the risk-based fees as opposed to sort of our current by either seats or square footage, in many instances the increase would be less for even the people who are getting a significant increase under risk-based. It would be less than the sort of original proposed one, so they would sort of get a better deal, for lack of a better word.
But I think we need to be consistent in how we assign fees.
Okay.
And I do like the risk-based approach, because to your point, when they're higher risk, I mean, you guys are spending more time at those places, and they can, change levels and all of that. That makes sense to me.
Yeah, I agree. I certainly hear size points on all that, so I like the risk-based.
Okay. Would it make sense for us to incorporate the risk-based information into the document that's on page 90 to 92? which was the sort of list the fiscal 25 fee, the current year fee, and then the next year fee. Just so the board could see it one more time next month, and then the board might be willing to vote.
Yeah, consolidated would be helpful.
Sure.
Yeah.
Okay. Great. We will do that then. Madam Chair, the only other item we have in our list is the next meeting is June 20th in the Charles River Room and on Zoom. The board historically meets usually one combined meeting, usually like the last week of July, first week of August. If the board's okay with it, I'll do a doodle poll to try to find a time, and I'll aim for, I guess I'll try to aim for sort of the Friday meeting slot on whatever the last week of July is or the first week or two of August, if that makes sense for trying to schedule a summer meeting.
Does that seem reasonable to
That's
people?
good.
Yeah.
Yes.
Okay. And we'll have a pretty busy agenda for June if we're going over fees and we're potentially holding a hearing, but we'll get working on that.
So Tim will have a meeting in June, and then you will be sending a doodle poll for end of July, August to have one meeting. Is that correct?
Yeah, we have the June meeting set on the 20th, which is a Friday at 9 a.m. In the Charles River Room at PSAB. And then I will send maybe later this week a doodle poll to try to get that summer meeting scheduled.
Tim, do we have meetings in the fall? Like I can't remember how long we had extended out that Friday morning, or we were going to revisit that. I can't remember where we are with fall meetings.
We were going to revisit that, and I think that it sort of, does the board want to keep going with the Friday at 9 a.m. option? Does that work, or would you like? Sorry, Ed.
I do.
Okay.
Yeah, I mean, as far as we can, the more we can schedule as far out as possible, the better for me.
Okay. Okay. Then we will get to work finding meeting locations and scheduling for the fall. Okay. Great. Okay, Madam Chair, I think that's all the other items we had anticipated, unless any of the board members have new business they wanted to bring up. I guess the only thing I might add, and I apologize,
Adjourn.
Oh, Ed, I was just going to update. I know you were there, but the other board members weren't. The design money for the Center at the Heights, which includes expanded fitness room space, a handicap accessible rear entrance, and an expanded kitchen that could do meal production, passed. I don't know if it was unanimous, but it was very close if it wasn't unanimous, which was good news. And the Permanent Public Building Committee held a meeting last night to start the ball rolling on that, to get an architect hired for that project. So that's exciting. I think that's a good sort of backup for traveling meals to make sure we have a solid foundation for that program in the future.
Great.
Yeah.
Okay. I think, Ed, I had interrupted you when you were about to make a motion to adjourn.
Yeah, so I'll make a motion that we adjourn.
Second.
Second.
Everyone agree? Okay, show of hands.
Okay. See you in June.
Thanks very much, everyone.
Hey,
Thank you.
Hey, everyone.
Thank you.